Record. Hi, welcome to.
Hello.
Hi, Doctor. Welcome to Alive.
Hi, Jake.
Thank you so much for being here. We have with us today an infectious disease specialist based in Chonghua Hospitals, the Cebu City Medical Center, and many other hospitals. Her name is Dr. Evelyn Alessna. Hi, Doc.
Hello, Jiggy.
And welcome to Alive. This is my search for the best way to live. And of course, this show that we're doing is supported by our good friends from Organic Acai. You know, if you want to stay healthy in this season, please make sure you guys exercise, get the right amount of sleep, and of course, have a healthy diet. And if you can't have a fully healthy diet every day, maybe you want to supplement it with a good supplement like Organic Acai. And with us today, we have an infectious disease specialist. Of course, we're here to talk about the coronavirus pandemic that is just engulfing not just Cebu City, not just the Philippines, but all over the world. And we have a specialist in our hands right now, Dr. Evelyn Alessna. Doctor, thank you so much. Thank you so much for doing this. I know you're very busy today. I know you're very tired, but still you found time to talk to us today. Thank you, Doc.
Yeah.
Doctor,
So,
let's
how
not...
can I help you?
Yes, please. A little bit of information goes a long, long way in issues such as this. And I think it's crucial that we equip the citizens of Cebu and perhaps the Philippines or the world more information so we will know how to battle this pandemic. Doctor, my first question is, where are we now in our response to the pandemic? Now, when I say where are we now, I mean, where are we now in the graph? Other nations like China, other nations in the East already are opening up, like in I think Wuhan, and some parts of Taiwan are already opening up, and some parts of the West as well. So we have all of these nations to learn from. And I assume, correct me if I'm wrong, that we are basing our response to the pandemic on their response as well and their best practices. So my question is, where are we now? Where is Cebu now in our response to the coronavirus pandemic?
So, you want Cebu, not the Philippines?
Let's
for
take a Cebu perspective first, and then maybe we can go Philippines later.
Okay, based on the data, on the number of cases, it's really projected that the number of mild cases will reach about from 18,000 to 40,000, and for severe cases around 900 to 2,000, those that would require hospitalization. Now, as you can see, we have a daily increase in the number of our confirmed COVID cases now seen in the barangay level. So we expect those numbers to increase.
So,
especially yeah.
In Cebu,
so the purpose for the enhanced quarantine is actually to buy time for the hospitals and the community to be prepared. So right now we are creating the quarantine facilities at the barangay level. That's the level 1. Level 2, we have the 3. The IEC, the Bayanihan Center at Sacred Heart, and the one being built at Block 27 at the North Reclamation area.
Doctor,
so that's for
the figures.
That's for the.
Did you say 18,000? Is that the?
Yeah. That was based on computation made by in UP.
Okay, so this is in
Cebu, especially
or the Cebu province, the whole island of Cebu.
For the Cebu, for Cebu province.
The entire island of Cebu. So where are
Yes.
we right now? How many do we have that have?
Our problem is we are only doing testing for selected individuals. We're not doing the mass testing, and it's actually not recommended.
Okay.
So we do selective testing.
Okay.
So
right
we do
now,
we do targeted tests,
okay.
and that's the reason why we are seeing this number of cases that's increasing.
So our tests right now say that how many positives do we have so far in our current state in Cebu City, Cebu Island?
I'm sorry, I could not recall the number anymore, but
More or less.
100, yeah, 170
So you're suggesting
confirmed cases.
that study in the University of the Philippines is saying that from that number of less than 200 cases in Cebu, the entire island Cebu, it'll reach to 18,000. Is that what the study is?
Yes.
At what point in time will we reach that number, Doc? And how many how much is the mortality rate of the 18,000 positives?
I know. When I say 18,000 to 40,000, those are for the mild cases.
Okay.
We don't expect any deaths among those among those population having mild cases. So among the severe cases, so that's around 900 to 2,000. If we have a case fatality rate of 5%,
okay,
more or less that's a case fatality rate here seen in the Philippines.
You know what, Doc? One of the things that's really scaring me about the coronavirus, one of the things that's really scaring me about the coronavirus pandemic, Doc, is that first world nations, very progressive nations like China, like Taiwan, and Italy, the United States, and other parts of the first world are having a hard time. And how much more for third world nation like ours? The figure that you study projected 18 to 42,000 is how much is that if you have the population for the entire country?
So that is the reason why we have the enhanced community quarantine.
Okay.
It's really to really prepare us in the hospitals,
okay,
to ensure that we have enough PPEs, we have enough equipments. So we are even scheduling we'll handle the COVID for the week, so on and so forth. How the proper procedure or algorithm. But we don't want to overwhelm the hospitals, and that's the reason why we infectious diseases specialists are also helping out in the public health preparedness in the barangay level, in the quarantine facilities.
Doc, where do we get our sort of modules for this response? Is this something that we get from the World Health Organization? Are we developing these ourselves here in Cebu or in the Philippines? In
Because you know, we are doing this so-called bayanihan.
Okay.
Bayanihan meaning we help each other out. So that was a very good. That's a good thing that came out from this problem because everybody was helping out.
Okay.
We needed to be self-sustaining.
Mm-hmm.
So that's why many organizations have really helped out in manufacturing these PPEs because of the lockdown and the high demand in the other nations. So that's why we have limited stocks of PPEs, and we really use a lot of this each time we handle suspected COVID cases in the hospitals.
There are those countries, Doc, that are doing very well. Like I said in the beginning of the interview, like Taiwan, like Greece, like New Zealand.
Because
they're doing very well. Are we?
The Taiwanese are disciplined, you know,
okay.
Very important for people to be disciplined.
Are we
So they follow.
are we learning from these nations, Doc, in terms of the way we are responding to our situation here in the Philippines? Are we learning from?
You know, as you can see, this is our first time to handle a pandemic. So it is understandable that we really had problems from the beginning, and we're learning each day.
Yeah, that's why.
We're learning each day. Yeah.
Um,
So at least before, I felt everything was so fragmented in terms of preparedness. But at least now, we now have a more integrated approach.
okay.
We now have a more or less integrated approach. So we now have a very good public and private collaboration.
How did we
Each has
develop?
to be linked to the other, from the barangay level to the quarantine facility to the hospitals. And organizations such as Cebu Medical Society, the Philippine Society, the Philippine College of Physicians will actually help in the community level and quarantine facilities.
How did we develop
So,
these procedures, Doctor? Did we develop it ourselves here, or did we learn from the best practices of those nations that are doing well as far as the response to the virus is? Did we come up with this ourselves?
of course,
Based
of course,
on
we learn from all the best practices, but sometimes we have to tailor fit. We have to tailor fit in our communities.
Mm-hmm.
So what limits us is actually the testing. We cannot test everybody, and we have to test just the targeted. So from the start, it took like a week or even up to 12 days for my first patient. It took me 12 days to get the result. The patient died before the result came out.
Okay.
But at least now that Vicente Soto is already considered a subnational lab, at least we now get our results in 48 hours. So that's a good thing. And some private hospitals are also getting their own equipments for testing, because we really badly need to test our patients.
One of the common things, the common thread with these nations that have already started opening up is their massive testing. In fact, that's the buzzword right now. If you want to open up, you've got to have massive testing.
No.
The state is having a problem with
that is you know, when you say mass testing, you know, we are a country of how many millions of Filipinos. We cannot do mass testing. It has to be targeted.
Okay.
So we have prioritization of those who get tested. We have prioritization. Not everyone should get tested, and to do that, you have to do the rapid antibody test. And there are so many false negative, false positive. So we feel that it should be targeted, not just everybody, because you might have a negative test, but it's a false negative test, but actually you have the disease. Or maybe it's a false positive and actually you don't have the disease. So it has to be balanced. So that's why if those tests are to be ordered, it has to be ordered by a physician, not by a politician. It should not be dictated by a politician.
You know, it's in some parts of the world.
So actually, we have guidelines for that. Who needs prioritization for those tests?
In some parts of the world, especially the United States, they have politicized the pandemic, right? Do you feel that we're also sort of politicizing this here in the Philippines? Because I see on sometimes that people are politicizing this.
We also need our politicians, because they have the budget.
Yes, of course. Yeah, I understand.
So we just try to influence them compromise.
Okay.
That's the way to do it. That's the way to do it.
You know,
So we try to influence and give the rationale why we need to do this, why we can't do that.
I read somewhere, Doc, that they're saying that the next epicenter of this pandemic will be in Asia, especially in the third world nations. Third world nations will be the most ill-equipped group of nations to respond to the virus. Imagine first world nations are having a difficult time, solving this pandemic. How much more for third world nations that don't have the facilities and the testing that is needed to have themselves open up as nations, opening up their economies sooner rather than later. Um, do you see that prognosis as well, Doc? Do you feel that if we don't have the tests, if we don't have the right facilities, the right equipment, and all that stuff, do you feel that Asia will be the next epicenter of this pandemic?
Anything goes. Look what's happening in Singapore.
Yeah,
You can have another wave, a second wave, a third wave, because you never know where it's coming from. You might, like for example, what's happening in Manila, at least the number of cases has gone down. So they have already reached the peak and the number of cases are going down. So actually the ECQ has really been helpful in trying to lessen the number, so the what we call reproductive number is 15 days, meaning it will take 15 days to double the number of cases. So right now, at least the number has gone down. So it takes a longer time for doubling of cases.
How many days are we now in quarantine, Doc? In Cebu, how many days has it been? I can't remember anymore. 15, 20 days?
I think maybe more than 30 days. I can't recall as well.
So
from a lack of sleep.
I know. And thank you, and we love you for what you do, Doc. Thank you so much. The mayor, I think, said earlier today that he is going to extend the lockdown, the quarantine period to May 15, if I'm not mistaken. Are we ready to open up soon, Doc? Is May 15 a good day to start opening up the economy here in Cebu, or should we wait a little longer? What are your thoughts on opening up Cebu? Yeah.
You mean the businesses?
Yeah, opening up the economy of Cebu. Yes, Doc.
It's gonna be modified. So my friend Dr. Brian Lim,
okay,
he's the one in charge on that. But we will be meeting this Saturday.
Okay. So
we will, because they need guidance. So actually, we in the infectious diseases will try to help out. So on how personal opinion, you have to redesign how to go about once you open the businesses. So it's gonna be modified.
Do you think May 15 is enough time for us to start opening up businesses here in Cebu?
Maybe not yet soon, because we are not yet prepared with our, except for Sacred Heart School, the Bayanihan Center, it's already prepared, but we are not fully prepared with the barangay level for the quarantine facilities, because when we have COVID patients, they need to be isolated in these facilities. For now, IEC is not yet ready, as well as the Block 27.
So if
because
you had to recommend, you would not recommend opening up on May 15, at least not just yet.
not just yet, until at the community level, the schools that were designated to be quarantine facility has already been prepared.
Okay.
And then we really need to give guidance for the different business establishments. So I think very important that we don't open up places for entertainment like movies or those public spaces. So maybe that's what we mean by modified. We gradually open the establishments, not open everything at the same time.
You know what, Doc? We have learned so much about the coronavirus in the 3-4 months that we are in quarantine, because we're watching a lot of news, we're reading a lot of articles, reading a lot of books, and we've all become coronavirus experts, so to speak. But I know you guys are the guys to talk to when it comes to the coronavirus. My question is, Doc,
there are so many things coming up.
What are the new things that you have discovered since the 3 months that we're experiencing this pandemic? We know that you need to wear masks. We know that we need to have social distancing. That you have to wash your hands. And properly do it. What else do we have?
Those are the basic things.
Yeah. What else? Tell me something new that we have discovered about the coronavirus, Doc.
It's very highly technical, medical aspects, so I'd rather not discuss it now.
But okay. What else can we do to stop the spread, aside from wearing masks, aside from social distancing? Aside from that's it. So it remains the same.
Yeah.
Okay.
And really complying with the social distancing and seeking treatment. And when you seek treatment, you have to be very honest, because there are some patients who will not tell you that they had fever, they had cough, they come in for another problem, and then they develop, or we observe them to have the symptoms, but they did not declare that they had the symptoms before they were admitted. Because we have a triage in the outpatient or in the emergency room. You are being asked these questions, and some will not tell the truth. Okay. So that's really endangering our healthcare workers.
Doc,
from the start, there were those who did not declare that they had history of travel.
Doc,
so really very important for people to be honest.
Okay.
Because you are endangering the lives of the healthcare workers who take care of you.
Doc, with this lack of testing, are you scared? People are talking about this on social media and also on a lot of news networks. Are you scared? Is the immunology community scared of a second wave? How probable is this second wave? And is a second wave less destructive than a first wave, or is it possible that a second wave could be worse?
Look what's happening in the other countries that had the first wave gone, and then they have another wave coming up. So in terms of whether it's gonna be worse or not, it depends on how prompt the response is. So if they do the lockdown right away, then maybe that will flatten the curve right away.
Okay. Doc, I'm down to my last few questions. Doc, some countries like China and Taiwan, and I think Singapore, they've already experienced SARS. They've already experienced similar situations such as the coronavirus pandemic. So they're equipped and more ready than most nations.
Yeah.
But I think
that's true.
But I think because we are in the age of information, there is no way, there is no excuse for us not to learn from them, from anyone for that matter, because we are in the age of information. So it's not an excuse not to be ready, especially now that we are here experiencing the pandemic firsthand. My question is, Doc, will we be ready?
SARS is different.
Yeah, but it's
SARS
still,
was different.
but it's still a coronavirus. But my question, Doc, is will we ever be ready for the next pandemic? Will the Philippines be ready for the next pandemic? Maybe not this year, maybe not next year, maybe 5 years from now, maybe 10 years from now. Are we going to be ready for the next one, if and when it happens?
No.
Why not? And how?
No.
What can we do as a nation to be ready for it?
I won't tell you what I've seen on the ground.
Why not? You should
We
tell.
are not prepared.
We are not prepared.
No. We are not prepared. I mean, if even the US, UK were not prepared, they were not prepared. Especially the US, they did not do the lockdown right away. And look what's happening in the US.
So, like I said, there's
now
the next.
with regards to SARS, SARS was different, huh? SARS was fatal, like 10% case fatality rate. So when the patients die, they don't transmit the illness.
Okay.
But with coronavirus, you have so many asymptomatic, meaning no symptoms, but they carry the virus and they spread it to 5 to 7 people. And those 5 to 7 people will spread it to 5 to 7 more. So that's the reason why we expect numbers to go up as we do the testing.
Talking to you.
So we usually test the close contacts of asymptomatic close contacts of confirmed COVID cases. So that's what we mean by targeted testing. So if you're a close contact, and when we say close contact, you take care of the patient, you are within 1 meter of that patient, and you're not wearing a mask, so that's considered a close contact. So you are advised to have screening for COVID.
You know what, Doc, talking to
so you, that's what happened in the barangays. They did contact tracing.
Okay.
First generation and even second generation, and that's why we had those confirmed cases.
You know what, talking to you right now, Doc, I don't feel very hopeful based on what you just told me, how ill prepared we are on the ground, the way
you have to remember, this is our first pandemic in, like, the first pandemic was 100 years ago. That was 100 years ago. And so, this is our first time.
This is our first time, and even
our first time.
Our first world nation.
But at least here in Cebu,
like the United Kingdom,
can tell
the United
you,
States, they were not ready for this. Even though they had the the technology, the hotel rooms, perhaps they were not ready for this. So, Doc, we
but the silver lining,
yes,
the silver lining in the Philippines is everybody is helping out in whatever form, in donating PPE, providing transport, food, so on and so forth. Those are also so very important. So don't worry, we are just very silent, but we are quietly working. We are quietly working.
So we have a lot of viewers right now of this podcast, and are wondering, when are they going to?
But the good thing
when are they going to go back to school? Is my life going to normalize? What do you have to say to those people, Doc, that are kind of worried about this whole lockdown thing, and they're also worried about of course, their health, the health of their loved ones. What's your message to them, Doc?
Please just follow follow the guidance. Follow the guidance, and you have to understand that the decisions will depend on the situation. So we hope, based on the prediction, maybe start opening July, August. I'm not sure.
July,
Okay.
August. That's a long.
So we're not really sure. Time will tell. Time will tell. So that's why we're glad that we have experts doing these prediction models, because I honestly do not know how to do those things. So I'm more of a clinician. But we're also helping out with the public health. And I'm so happy with the way the city is responding. So they are involving all the stakeholders, and everyone is working together. So for me, that's a silver lining. We now have a more integrated approach, unlike before, like everybody was doing their own thing. But at least right now, we now have a more integrated approach. We now have this so-called link from the community up to the hospital level. So we just don't want the hospital to be overwhelmed. So that's why we need to have this community preparedness. And then you have that quarantine facilities for the moderately ill patients, or those with mild COVID but are elderly or have comorbid conditions that needs closer monitoring by nurses and doctors.
Doc, speaking of hospitals, are the hospitals that you've been assigned to getting or starting to get overwhelmed? Or do we have enough?
Initially, we were overwhelmed.
Okay.
Because when the clinics closed down and people got scared, they all rushed to the emergency room by the hundreds.
Okay.
And we were really seeing very sick patients. So, the Department of Health actually has surveillance. Like, they have this surveillance wherein we are guided as to who needs to have the testing done.
Okay.
So we have the influenza-like illness, severe acute respiratory infection, so on and so forth. So we have this guidance from the Department of Health. So anyway, in last March, there was really a surge of cases. Yeah.
So
So
as a final question, Doc,
at least
we have a lot of friends out there who would like to help. Is there a website, a phone number, a place that you can reach so that we can help?
We now have a command center.
Okay.
We now have a command center. It was created within the week. So that all donations goes to that command center, and they will be the one to distribute it to the different hospitals if there is a need. So that's what I mean by we now have a more integrated system. So we have a command center that will know how many quarantine facility, how many beds are available in the quarantine facility in the hospital. So in case patients needs to be transferred from the barangay level to the quarantine facility or to the hospital, they call the command center, and the command center will direct where they should go. So that's one thing. And for all donations, it goes to them, to the command center. And if a hospital already runs out of PPE, they call the command center, and the command center will try to help out these government hospitals. And we also ask them to also help out the private hospital in case the private hospital runs out of PPE.
Doc,
So
since you're an immunologist, Doc, how important is
of infectious diseases, I'm not an immunologist. Infectious diseases.
An infectious disease specialist. Since you're an infectious disease specialist, Doc, I'm wondering how important is having a healthy lifestyle in this pandemic. Is it important to have the right amount of sleep, exercise, diet, and all?
Even without a pandemic, you need to have a healthy lifestyle.
But how important
No
is it
smoking,
now?
no alcohol. Yeah, more important, but even healthy and young can also get severe cases. Yeah. So, but more among the elderly. So we really have to protect our elderly. So I have a 99-year-old dad with me. So that's why he's wondering why I'm sitting like 3 meters away from him.
Does he understand?
So I have to be careful. He's 99, so I just tell him like, there's a curfew out there. I can't buy your Mountain Dew.
Mountain Dew?
There's a virus. So,
is Mountain Dew his secret to a long life?
Yeah, for him it adds to his life. So he's already 99, turning 100 this September.
Wow! Congratulations.
So I have to keep him alive.
It's funny that you talked about that. I have an aunt who recently died just a few days ago. She was 89, and her secret to long life was Coca-Cola.
Yeah. That's what I also heard from other elderly patients. They would ask permission if they can drink their Mountain Dew or their Coke, even while in the hospital. For as long as they're not diabetic, I allowed them to. Yeah.
Doc, I know I said this was my last question, but this is my super last question. Aren't you scared that you're out there in the front lines, exposed to the coronavirus? How do you feel about your job right now?
At the start, we were also afraid. I actually cried. I cried. But nowadays, because I know how to protect myself, and we have a very good hospital that takes care of us, so that's no problem. Okay. But of course, I pity more the nurses who stays longer in the ICU and the residents and the fellows. So they spend more time with the patient than us. So, but anyway, they are wearing appropriate PPE. So that's the reason why we need to have adequate numbers of PPE, because that's the only way to protect us. And apart from the other environmental design that will try to minimize the viral load.
Doc, you mentioned that you have a command center that people can donate. You never mentioned where it's located.
It's in the, I don't know what's the name of the building. It's near it's near City Hall.
Okay.
Behind it, I'm sorry, I forgot the name. So it wasn't occupied. Like, okay. It was just empty.
Okay.
And because we felt it was a good place.
Thank you so much, Dr. Evelyn Alessna. She is an infectious disease specialist at Chonghua. Thank you so much for that beautiful interview. And of course, this show that you're watching, Alive, My Search for the Best Way to Live, is brought to you by our good friends from Organic Acai. You know, to be healthy in these very troubled times, especially, make sure